What's up, Art of Wellness podcast? Today we're talking all things men's health, men's sexual health, and pelvic health with Dr. Julia here, Julia Rosenthal, physical therapist like myself. What's up, Julia? How are you?
I'm good. How are you?
I'm doing great. I'm happy to have you. And we have
Thank
a
you.
ton of things to talk about. But first, let's get a little bit of a background on you. Where'd you go to PT school, and what types of clients do you see in your practice?
Sure. So I went to PT school at Columbia University in New York City. And since then, I have had like a couple of different phases of my career. In the beginning, I was working in a 100% dance medicine based clinic, and that was like a hospital based outpatient. I was in a residency at the time, and so there was a lot of kind of study and treating happening at the same time. That was sort of
Mm-hmm.
phase one. Phase two was I worked in an out of network one-on-one care private physical therapy practice that was 100% pelvic health. So I saw a lot of really complex cases, a lot of chronic pain,
Mm-hmm.
a lot of pregnancy and postpartum and other things in that location. And now I have my own practice and I see a pretty good
Nice.
mix of both. So I see a lot of people with pelvic health conditions, but I also treat a pretty good amount of orthopedic injuries, athletic injuries, post-op care.
Nice.
And there's like a pretty good, healthy mix of what we're doing here. But all of it is with the intention of being very movement forward and giving people tools to be well for the long term instead of, a knee hurts, treat knee type of approach.
Awesome. Yeah, that's where we kind of connected was like, I think we both started our practices maybe around the same time, like during
Mhm.
COVID, right?
Yeah, I think probably a similar thing happened where it was like, it was really
Mm-hmm.
hard to be working in a private pay clinic or
Right.
even just like any outpatient practice. Like there just weren't clients coming in. And so, businesses restructured and it left a lot of people trying to figure out what was next.
Yeah, and like I don't know if you're ever like me, but I always had it in my head to start my own practice regardless, so that just kind of accelerated the process for me. Was it the same thing
Yeah,
for
I
you?
was not like that.
Okay.
I was like, I absolutely do not want to have my own practice. That's
Oh
not what I
wow, okay.
want. I want to go into academia. I
You
want to
did tell me
like
that before, yeah.
be a professor. Yeah.
Mhm. Is that still
That
your
was the
plan?
plan. No, no longer the plan. I kind of pivoted when I realized that, you know, I really like being around people. I like working with people.
Yeah.
And as much as I like teaching, I think I like doing it in a context that is not so fully academic and in a way that's like a little bit more fluid and in a clinical settings.
Right, right, right. Yeah. I say we just jump in to all this stuff.
Do it.
What do you think? All right.
Yeah.
Let's do it. So I kind of want to go back and forth with you on this one a bit, but why do you think, men in general, well, don't even know about pelvic floor PT, and why don't you think they even seek it out as a form of healthcare for them?
I think there's a lot of reasons. I think one, a lot of people of all genders don't know that pelvic PT
Right.
exists. And
Hmm.
so there have been a lot of barriers to care for all people to this type of care. And as people talk about it more and more, even the American Physical Therapy has different sections for types of physical therapy. And because there was such a need for care for people in the pregnant and postpartum period, initially the section that was for this type of care was called the section on obstetric health. And so there was this very like women's health focused version of pelvic health that was out there
Hmm.
because, frankly, there really was a need for that. And a lot of women's health issues were being overlooked.
Sure.
But the more people started treating those issues, the more they realized wait a minute, we are dealing with things that are really present in all kinds of different genders and different parts of the population that
Yeah.
maybe haven't even really been addressed. So it was almost like the doorway to really open up this type of care to lots of different people. And I think that history really has played out in terms of who is aware that this is a type of care that's available to them.
Yeah. Um, I mean, lack of awareness is big, especially with this stuff. I think too, like, from a guy's perspective, a lot of times, like, we, I guess, if you want to say, like, suffer in silence or whatever, like, we don't want to be like, oh, something's wrong down there, and tell
Yeah,
somebody
I think
about
people are
it.
afraid to talk about it.
Right. And like I
It's
said, in general, people are afraid to talk about it. And I think from our point of view, it's like, hey, bro, we're good down there. Like, I don't need any help from anybody to figure these things out, whether it is erectile dysfunction, ejaculation issues, stuff like that. But um, it is
maybe
a
we
scary
should back up
topic.
and talk about what pelvic floor physical therapy
Yeah, that was my next
is.
question. But yeah. So, yeah, go ahead and explain
Like,
what,
what do we
what
do?
pelvic
Um,
PT is and what you do with your clients.
Yeah. So when it comes specifically in men's health, pelvic floor physical therapists, in general, actually, pelvic floor physical therapists are treating people who have issues with bladder, bowel, or sexual dysfunction. So that's across all genders. And part of it's kind of like the way that I explain it to people is like it's regular PT plus because we have skills in evaluating the muscles that are inside the bowl of the pelvis, and those muscles have a role to play in all of those functions. And a lot of times you don't think about a musculoskeletal component to having to pee all the time or
Right.
being really constipated or having issues with erections or any of the things we've sort of touched
Hmm.
on. But there is a neuromusculoskeletal component to all of those things. And that is the piece of it that pelvic floor physical therapists are trained to manage.
Yes. Okay. So again, that's more broad spectrum here. Let's start narrowing things down here. So I
Hmm.
mentioned erectile dysfunction, other male issues like premature ejaculation, things like that. So how can pelvic PT in particular help with these things?
So there are three layers of muscles in the pelvic floor. The anatomy of the actual musculature in the pelvic floor is very similar, regardless of what type
Hmm.
of genitals you have. And those muscles have a variety of functions. Some of the outermost ones are responsible for pumping blood into and keeping blood in the penis. So there's a very clear relationship there between achieving and maintaining erection or potentially pain around arousal and erection because some of those structures could contribute to that also. And the nerves going into that area might be at play also. Then you have a layer of muscles that is primarily involved in urinary function. In a male pelvis, there is a different path of the urethra
Hmm.
because the urethra goes through the prostate. The urethra is much longer, and so it actually dips down below the height of the pubic bone and then kind of comes back up. So there's like a dip
Hmm.
in the path of the urethra, and then it travels through the penis. So there's it's unless there's some kind of like reason, whether it's a surgical reason or some other kind of more neurological reason, there's not usually just like stress incontinence that's a little bit less likely in a male pelvis, but you might have things like post void dribbling where you go and then there's like a little bit that came out that was kind of outside of your control.
Hmm.
um People with male pelvises will also complain a lot about um urinary urgency or like feeling like you have to go all the time, or when you have to go, it's like, I gotta go right now. I gotta find that bathroom.
Yeah.
Those are more the types of urinary symptoms that men will more frequently complain of. And then there's the next layer of muscles is like a bowl. It's kind of like shaped like this,
Hmm.
and all of your pelvic organs sit on top of it. And those are the ones that people think of when they think of like the pelvic floor, because they're
Yes.
thinking of
Hmm.
like the pelvic diaphragm. And those muscles work together with the muscles in your abdominal wall and your diaphragm, and are part of this pressure system that exists between your rib cage, the space in your rib cage, and the space in your abdomen to manage things like coughing and sneezing or creating enough pressure for a deadlift or all kinds of things like that.
Yeah.
And so you might have things that seem like musculoskeletal systems, like sacral area pain or tailbone pain, hip
Yeah.
pain, low back pain. And there may be a pelvic floor component to a lot of those things.
Yeah, and we'll talk about that definitely later on because, as always, as we say as PTs, everything's always connected to each other and you can't separate out systems. Everything works together as one. So if one thing's thrown off, it could throw off other things. The whole regional interdependence of the human body is extremely important. Um, how do you assess, like, if somebody is either tight or they're weak? How do you assess their muscle tone when it comes to the pelvic floor?
So I will start this by saying that a lot of people are afraid to come to pelvic PT because they are afraid to have an internal exam.
Hmm.
And I will talk about what the internal exam looks like in a second. But there is a lot of information that we can gather without ever doing that. And so if you are like, oh, this is something somebody told me I needed, but I'm like scared because I don't want somebody to do that, it's okay. We can work with that. That's completely fine. But if we're going to do a very specific hands on, like palpation, feeling the muscles assessment, usually it happens in two parts. There's an external component and an
Hmm.
internal component. External component, we're basically feeling for the musculature that I was describing in the beginning, and the first layer, the layer that's primarily responsible for pumping blood into and keeping blood in the penis. Those muscles you can touch from the outside. If you
Hmm.
lift the scrotum and feel along the bones in the area, and then also in between that space, there are muscles that kind of feel like a tube. You can palpate a lot of those muscles. Sometimes you can recreate pain. Sometimes you can feel that there is like a difference in tension from one side to the other, or like a lack of tissue mobility in the area. So that is something we might do in the beginning in an external exam, pelvic floor specific exam, and then on an internal component for a person with a male pelvis, that deeper layer of muscles, the bowl of muscles, is deep enough that mostly they need to be reached. If you're going to try to touch them specifically and directly, they will be accessed rectally in a person with a male pelvis. And so what we're doing is we're looking for specific muscles within that group of muscles to see, am I recreating pain when I touch these muscles?
Hmm.
Are you able to relax them? Are you able to contract them? After you contract them, can you relax out of
Yeah.
that? If you're having constipation issues, like what happens when you try to bear down? Or is the anal sphincter, which is like the outermost part of the canal, the end of the canal, is the anal sphincter super reactive to movement? And so, are you maybe trying to have a bowel movement, and every time something tries to pass through the passage, you're clenching up and you can't get anything out?
Yeah.
Maybe we need to retrain that a little bit. So, we're looking for symptom recreation and then also patterns from like a musculoskeletal component. Weakness is like when we ask you to contract, we're looking for a close and a lift. You should be able to pull up and in for a successful pelvic floor contraction, which is also a Kegel.
Hmm.
But a lot of the time, a lot of these symptoms are coming from increased muscle tone rather than
Okay.
decreased muscle tone,
Yeah.
unless there's some kind of like surgical reason why somebody is unable to recruit the muscles.
Gotcha. Okay. And I was gonna kind of go down the list with each one of these. So, like, let's start with. I know it depends, and everybody's different. Is different. Everybody presents differently, but like in a very general sense, like erectile dysfunction, for example, would you say it's just mostly like a tightness type issue, where the blood flow to the genitalia just isn't getting there? I mean, I know it's not just that, but is that part of
Yeah.
it
From
that
a
you've seen?
musculoskeletal standpoint,
Yes.
right?
Yeah. Hmm.
Obviously, erection is multifactorial.
Yep.
There is also a significant cardiovascular component. There was
Yeah.
actually a study that came out that was, it's basically talking about erection as like a vital sign. And so
Yeah.
for
Yeah.
people, I think it was men under 40, if you're having problems with erection, the recommendation is to go have a cardiovascular assessment
Right.
to make sure that that is not the reason why it's
Hmm.
happening. So there are some things to sort of like check off the list as potential contributors before we're going to rely as pelvic
Hmm.
PT for the answers.
Yeah.
But typically, yes, well, it could go both ways because you need the muscles to be strong enough to pump blood into the penis and then hold it there. So there
Yeah.
is a strength component. But tight muscles are also weak. So we also need them to be able to lengthen enough to do
Mhm.
their job.
Mhm.
Plus, if they are holding a lot of tension, it's hard. Part of the job is to hold fluid in the penis. So if they can't relax enough, it's harder to get fluid in there to begin with. And then
Right.
that can be a part of the reason why it's difficult to have
Mhm.
a full erection.
Gotcha. Yeah, and I think, from what I've seen in the podcast space, I would argue that most people don't know that musculoskeletal part of erections. I would say more people know about the cardiovascular stuff, honestly, because pelvic floor, like you said, most people in general don't even know about it. So I think, the podcasts I've seen, like, they've talked about cardiovascular stuff, hormonal stuff. They don't even mention the pelvic floor. And I'm
No.
like, as PTs, we're like, hey, like, you're missing this whole other component of sexual health. So,
And the reality is a lot of those people will be put on medications,
yep.
like usually Cialis, and they don't always have success with that. And that's so frustrating for a
Hmm.
person who's struggling with erections. It's like, okay, I'm literally on the meds and it's not even working.
Yeah.
What is going on?
Yeah.
And unfortunately the reality is they end up like spinning because nobody
Hmm.
is telling them that there is another piece of the solution.
Yeah. I mean, as guys were like, oh, it's a testosterone problem. It's a hormonal problem. Let me check my blood, blood flow. Let me take more
Right.
blood flow supplements. And again, like I said, they're just missing the musculoskeletal component of the muscles down there that contribute to all these things. And I think it's important to talk about this where, we're the conservative health people. Like, this is something that can be fixed, and we're not using, like you said, pills or
Right.
things like that. So it's a very important part of healthcare, I would say.
There's a
Um,
time and a place for sure. Like I've
of
had
course, I'm not
people
arguing
who
that at all.
need
Yeah.
maybe need the meds, but also had better, more full, more successful erections
Hmm.
with the meds plus the PT,
Yep.
you know?
Yeah. In conjunction, it works great. I'm always just saying, like, on the totem pole of like where people look in healthcare, we're still like down here where I think we should be equal with, looking at
Yeah.
all these things in a, like you said, in a biopsychosocial approach, multifactorial, looking at the whole person, not just like it's just blood flow, it's just hormones, it's just this.
Hmm.
Like, let's look at everything and completely assess the patient in front of us. But we get on these healthcare tangents, and I wish we could help everybody, but unfortunately the healthcare system like likes to throw people in different directions. And my goal with this podcast is to hopefully, you know spread the good word about us as PTs, and
Yeah.
get people to recognize that we are an important part of healthcare, and we are very um it's more conservative, and that's okay,
Yeah. And that's a
um
good thing,
yeah.
honestly, because it's more sustainable in the long run. But I think especially, I think part of being a pelvic PT is recognizing that I'm probably like the 10th person that you saw about this. you
Yeah.
know, and you probably spun and spun and spun until you finally got here.
Hmm.
And even within pelvic PT, and this is true for all PT, right? But even within pelvic PT, there's so much variability in what you're going to get
Yeah.
from provider to provider.
Yeah.
And
Yeah.
so, the unfortunate truth too is that like people will come to me and be like, listen, I went to this place and all they did was like these internal releases and I never really felt like I got better. And then they come here and I'm like, you have zero hip internal rotation.
Yeah.
Like, no wonder your pelvic floor can't relax. There's no room for it to.
Yeah.
So there is, even within us and our scope, a need to kind of like zoom
Oh
out a
yeah.
little bit more to make sure that we're covering all of our bases.
Yeah, and there's different layers to that. The For lack of a better term, the crappiness of healthcare these days is like, yeah, like maybe somebody does go and they get PT from some clinic that is overbooked and they're all overstressed, and the PT is seeing three people at a time, and that's not very good PT. And then, like you said, they come to us and they're like, oh, like, we're actually assessing them and we're with them for the full
Yeah.
time and looking at all these different things. Whereas those PT places, like, I worked in those environments and I had no time to, and I hated it. I was like, I,
Yeah.
I couldn't look at their internal rotation for anything because I was like, I was so stressed that somebody else walked in as I was evaling this person right now. And I was like, well, now what do I do? Like, I have like no time to even assess somebody. And, there's different layers to the healthcare problem we have these days. And yeah, I mean, I wish every PT can like hone in on their skills more and actually evaluate the person like we do. But hey, that's healthcare for you, I guess. It
Mm,
sucks. But thankfully we disconnected from that, I guess. Cause man, was it tough. But
yeah.
anyways, let's go back to so we did erectile dysfunction. So like let's go down the list here. So even like with premature ejaculation issues, again, like would you say it's more so like a tightness type thing, or like what would you say the symptoms that people have with that in their pelvic floor?
A lot of time, generally, that one is also like a more tone problem, but there is a possibility because the job is for the muscles to maintain erection. There is a possibility that there is a weakness component. That
Mhm.
being said, premature ejaculation is different than losing an erection, right?
Mm.
So there is also like a sensory, like a nerve component or potentially like an increased sensitivity in the small nerves of the penis, which could
Yeah.
come from some kind of like compression of the nerves a little bit further up, or even like farther up. A lot of the innervation to the pelvic region comes from the like mid spine, thoracolumbar
Yes.
region. So sometimes even issues like way away from the pelvis can have a contribution. So a lot of times you have to kind of like think if you're not really finding anything in the pelvis and you've kind of ruled out other non-musculoskeletal things, you
Sure.
sometimes have to kind of think higher
Yeah.
to get to it.
And again, we're speaking in generalities here, so I think it's important to say,
Yeah.
like, as we always say, me and you, we say this all the time, like, people need to get a thorough assessment from a pelvic
This
floor
is not
PT.
medical advice.
Yeah, sure.
Yeah.
Yeah, yeah. But, like, a thorough examination and assessment from a PT, or if it's a pelvic type issues from a pelvic floor PT, is always best. And I will, we're giving general advice here in a way, but like, go see a PT for a thorough examination. That's always best.
We do virtuals. Just saying.
Yeah, yeah, we do that too. Okay, so we ED, premature ejaculation. I also have down here pain with ejaculation and orgasming. What's the story with this as it relates to the pelvic floor?
Yeah, so a lot of time, so that can be a muscular tension issue. Usually pain symptoms are more of like a high tone
Mm-hmm.
issue, generally,
Yeah.
in the pelvic floor. With that one specifically though, I have seen in my this is like there's no study that says this,
Yeah.
but in my clinical experience, when I hear that, I get suspicious of a hernia because I've seen it happen enough times where those things have happened side by side.
Mm,
That like if I'm doing all the things and that person is not getting better, I'm going to be like, you need to go be evaluated and see if this is part of the problem. I
yeah.
have a client right now who has pain with ejaculation and
Mm-hmm.
had inguinal hernia repairs and then still was having symptoms and then went back and then they found a sports hernia and then
Yeah.
had like a diagnostic injection done in that region and his symptoms were gone for like a couple of like gone for a
Mm-hmm.
couple of weeks after he had that and he was like great, now I'm going to have this surgery. And I was like, listen, at least we found the issue. So
Yeah.
he ended up having PRP injections and is
Yeah.
doing better
Okay.
with that, but he knows it's just like a stepping stone to ultimately probably having to have that repaired.
Yeah. Uh, always tough cases with this stuff. So I wrote down as well, like surgeries, like pain with in that area after surgeries. What types of surgeries contribute to like chronic pelvic pain, would you say?
Hernia.
Okay.
Because the reason is that in the inguinal canal, you have you have nerves basically that go and supply sensory innervation
Mm-hmm.
to the penis and testicles. So if something happens and there's like compression on the nerves in that area or like poor neural mobility of those nerves, then you might have some painful symptoms. Usually I've seen it go the opposite way of like the hernia was there and so there was pressure pushing into the canal and then once the pressure was alleviated things got better.
Yeah.
But in some rare cases I've seen people have post-op discomfort. It usually goes away.
Okay.
But
Hernias.
I've had
Yeah.
some of those. Prostate surgeries, people can have pain, but usually it's more what the known risks are of a prostate surgery is urinary incontinence. So that is one where there's like a probably a guarantee basically that you're going to have urinary incontinence after that surgery, and then also lack of erectile function, and that's because there are a lot of different techniques for we could do a whole podcast on prostate surgeries, but
Sure.
essentially what they're doing right is they're removing the prostate
Yeah.
because of prostate cancer and there are a lot of nerves surrounding the prostate, so to the
Yeah.
extent that it's possible, they try to spare the nerves when they
Yeah.
do that surgery, but there is going to be some damage
Yeah.
to those nerves. And so
Hmm.
there are a lot of things that we can do to improve urinary continence. Sometimes we can help people regain erectile function, but there's also surgical interventions to help people like there are penis pumps now that are like they're pretty cool actually. Like the
Pretty
pump
cool.
is they're super cool. Like the pump is
Super cool.
hidden in the scrotum so you can actually pump it up
Yeah.
without but there's like no visible thing on you. So that's pretty cool.
Hmm.
There are clamps that are used that people can wear. So basically you're like clamping off the
Yeah.
urethra so you can basically be continent and not have to wear any kind of like adult diapers or any kind of like padding or anything like that,
Yeah.
which is very liberating for a lot of people. So there is a sort of like a lifestyle change piece of managing that, but there is also very good evidence for improved results on urinary function and sexual function if you do PT beforehand.
Mm.
Prehab is like super important.
Love
Prehab
prehab.
and post.
Hmm.
And a lot of people having these surgeries never even hear about pelvic PT.
Yep.
It's very sad.
Yeah.
And that's something that, like, really, I think it's on us, the pelvic PT community, to continue to educate urologists and people who are doing these surgeries about because truly, like, the outcomes are significantly better when people have pre and post op care.
Yeah. And I think, we're narrowing down for just like pelvic floor and pelvic PT, but I think in general, PTs and prehab for like ACL injuries, other surgeries like that in the musculoskeletal system is extremely important. And, I think, again, like you said, pelvic PTs, I always say PTs in general, we need to speak up about all this stuff because I still think nobody really like knows about us. And we're a huge part of healthcare. Like I said, the conservative part, we get people better without pills and surgeries and things like that. So it's, I try to like generalize as much as I can because, prehab in general is very important as
Yeah.
well as obviously for pelvic PT stuff. But
Yeah. Oh, I want to bring up one other surgery,
please.
hip labral repairs,
Okay.
because there is such a strong connection between your pelvic floor musculature and your hip musculature.
Hmm.
And sometimes, or even just like people who have like persistent hip issues.
Yeah.
So regardless of whether you even had the repair, but especially after the repair, like somebody on your care team should be asking you if you're having pelvic floor symptoms, because I have seen that happen many
Yeah.
times.
Okay.
Groin injuries, groin
Yeah.
strains,
Yep.
those kinds of things.
Yeah. Um, yeah, it's important that again, these patients get, asked about these things, but oftentimes, like you said, they're just overlooked and
Mhm.
it's not fun when that happens. Let's see. So we talked about, did we touch on like changes in orgasm too a little bit, or did you want to expand on that a little bit more?
We talked about pain with orgasm.
Okay. What about just changes?
Changes in orgasm. Orgasm is an interesting thing. Like men can ejaculate without orgasming. And so that's also a super multifactorial thing. There's a psychological piece, there's a
Yeah.
sensory piece, there's like a safety, emotional safety in the environment
Yep.
piece. But I think from like a pelvic floor perspective, part of what is happening, aside from like ejaculation aside, part of what is happening during an orgasm is that the pelvic floor musculature is like contracting and
Yeah.
relaxing. It's part of the sensory experience. So again,
Mhm.
it's like is it weak? Is it tight? We don't really know because it could be both. Like it could just be that there's not a very strong contraction. And because of that, there's like a decreased sensory experience. It could be that the muscles are really tight and so they aren't contracting as successfully and there's less of a positive sensory experience. It could be that there's some kind of decreased neural
Yeah.
input to
Mhm.
the area coming either from within the pelvis or from before the pelvis somewhere in the body, that's contributing to a change in sensation in the
Mhm.
area. I've heard people tell me that their penis feels kind of numb, like it's not numb, but it doesn't feel as sensitive
Okay.
as it normally does to them. So that's kind of like if that's happening, clearly it's going to be more difficult for you to feel as powerful, or maybe it's going to take longer for you to achieve an orgasm because it's like harder to get yourself to a heightened sensory
Yeah, yeah.
experience.
I'm gonna go down that list again of what I think is important with like erections and um, with guys and stuff is like we talked about like hormones, blood flow. You mentioned the psychological component. We can't ignore that as well. And we're not the experts on that. I don't claim to be the expert on that, but it would be cool in the future to have someone who's an expert on the whole psychology of it to have on this podcast. But that's another huge component of it is like the stress to perform or the stress to
Totally.
that gets in somebody's head. So we can't ignore that
I'm
as
not
well.
a I'm not a sex therapist, but
Right.
I have a certificate in sex counseling, and a big part of that, I mean, there's so many things that we could
Yeah.
talk about with that. That it's a huge topic. But just on like a kind of on a sort of basic level,
Hmm.
we all live in these like narratives of what it is to be ourselves in our bodies in a sexual context. And
Yeah.
those things are influenced by our race, where we grew up, our social
Yeah.
environment, our relationship history, like our parents.
Right.
There's so many things that influence our sexual narratives, that are things that a lot of people never acknowledge. And I'm the kind of person who's like everybody should be in therapy. Like every single person should
Yeah.
be in therapy. And I think a lot of it is that like if we are not sort of like asked to reflect on these things within ourselves, we never will. It's just like uncomfortable. So why are we going to do that?
Yeah.
So yeah, I think when it comes to like sexuality and like what it means to be a sexual being for oneself, there's just like so much to delve into.
Yeah, there is. We could probably do a whole podcast on that. Interesting stuff. Yeah, there's a lot of stuff that goes into all these things, like we say. But let's get back to like the loss of sensation and changes again. But I wrote down here cyclists and heavy lifters, as well as like you said, the surgical component of it after
Yeah.
surgery. People have issues with that stuff as well. But like heavy lifters and cyclists also have these issues. Would you
Yeah.
say?
So the reason that cyclers commonly have this issue is that typically the male pelvis is narrower than the
Hmm.
female pelvis, just like on an anatomical level.
Hmm.
Um, Statistically. And so part of what happens is that like because of that narrower shape, the bike seat sits like both of the sit bones are like hugging the bike seat. This can happen in people with female pelvises too, but
Yeah.
this is why it's like common in people with male pelvises. So the pudendal nerve, which is like a major component of the sensory and motor function
Hmm.
in the genital area, goes right along the inside of the sit bone. So you're basically like compressing it over long periods of time on the bike
Hmm.
seat, which is
Right.
why oftentimes cyclists will have this issue. Um, When it comes to heavy lifting, that one is a little bit more, it could be a couple of different reasons. It could be there's like a major glute gripping strategy going
Okay.
on and just like a lot of posterior pelvic floor tension as
Mhm.
part of the lifting strategy. So
Yeah.
that's one possibility. Another possibility is, especially for people who are lifting in a belt, and maybe haven't learned how to like successfully use the belt and
Yep.
instead are using it to just create a whole lot of downward pressure. You can do
Yeah.
that with or without a belt,
Yeah, yeah.
but the belt sometimes makes it worse.
Yeah, yeah.
Um, Sometimes it makes it better. You just have to learn how to use the belt. But
Yep.
anyway, the reason is that because your pelvic floor is part of that pressure system that we were describing, there's like all of this downward pressure onto the muscles, and then the muscles have to withstand that. So they're working against all of this
Yeah, yeah.
pressure that's coming down. And you know, because men have a different urethral path than
Mhm.
women, they don't really have as many issues with leaking on the platform. But that's the same reason women leak on the platform, right? It's
Yeah.
like a pressure management issue of like there's so much downward pressure from this effort that the pelvic floor may not be able to withstand it. And so it might show up different in like a man that's lifting heavy versus like a female heavy lifter.
Gotcha. Yeah. Cool stuff.
Constipation is a big one that I hear with that
Constipation?
group. Constipation.
Okay.
Because they can't, not to be crass, but like they just can't get their butthole to relax. They just
Yeah.
like cannot do it.
Yeah.
So
That's never fun.
nothing's coming out, you know?
It's just stuck there. All right. I put down vasectomies too. What types of issues have you seen with this, in terms of the someone's pelvic health?
Yeah, I think honestly, like anytime you're doing anything procedural in the
Yeah.
pelvic cavity, your body can have a response. Like, I don't have a solid reason for you why. Um, from to say like somebody went in the pelvis
Yeah.
and you know maneuvered some stuff. There are often like there can be like scars
I say this
inside that
all
we
the
don't
time.
see.
Yep.
You know,
Mhm.
there's it's like the way that I usually describe it to people is like our container on what we see on the outside and our contents are in constant conversation with each other. And so if the contents are like mad for some reason, we might experience that in the container because we don't really have the same experience of the content of like the contents, you know?
Yeah. Yeah. Man, yeah. Again, like I say that about most surgeries. I mean, when someone's saying like, "Why is it still hurt?" or "Why am I still having issues with this?" Post-surgical, everything's a process. Someone went in there and rearranged stuff, and sometimes your
Right.
body's like, "Hey, what just happened to me?
What happened?
What's going on?"
It's honestly trauma. It's
Oh yeah,
trauma
surgery is
to your
trauma. I say
body.
it all the time. I say it all
Yeah.
the time. And again, that's I have to explain it to them, which is fine. Some people just, it takes a while for them to kind of wrap their head around that someone went in there, moved things around, and your body reacts sometimes negatively. And it's like, hey, like
Right.
what's scar tissue, more pain, nerve sensitivity can all shoot up, and your body's like, hey, I don't like this right now. Let me give you a ton of pain and stiffness and all this other stuff, whatever joint it is, shoulder, knees, whatever. So it's good to kind of like reinforce that like you had a surgery and it's
Yeah.
trauma
It was a
and
major event.
it's a major event and your body's gonna be like, hey, what just happened? Here's some pain and
Yeah,
tension
I
and
mean,
scar tissue.
vasectomies are in the scheme of like surgeries that a person might have. It's like a
Mm-hmm.
pretty
Yes,
low threshold intervention.
sure.
But,
Still,
you know, your body might still not
everybody's
like that.
different. Yeah,
So, yeah.
everybody's different. Somebody might just not like it a lot at all, and they're like, hey, like what's
Yeah.
going on down there?
Yeah.
Um, I have down here chronic pelvic pain syndrome, non-bacterial prostatitis.
Yeah.
Do you want to expand
This
on
one
these?
is like this one drives people completely insane.
Okay.
They go to the urologist, they're probably having some constellation of symptoms like urinary frequency, issues with erection, arousal. It could be anything. Post void dribbling, that one's very common too. I'm not sure if I explained what that is, but it's basically like normally when men pee standing up, it's like you
Mm-hmm.
pee. and then maybe you have to like do a little bit of a squeeze to get the last of it out, and then it's done.
Mhm.
And you just to pee, you just kind of like stand there and like let go.
Yeah.
But what people who are having like a lot of pelvic floor muscle tension might have to like push to pee, or
Mhm.
maybe they pee and it's like immediately they feel like they have to go again and they try to go and like a little bit more comes out, but they just like can't feel like they've totally emptied. Or they pee and then they're like walking away from the bathroom and this like little dribble comes out and they're like, what the hell was that? Like um there's a lot of ways this could show up for a variety of reasons of like specifically what's going on in your pelvic floor that we don't have to get into. But all of them, sometimes there's genuinely a bacterial infection. Unlikely. That's
Yeah.
rare. That's like the least likely form of prostatitis.
Okay.
Usually people are diagnosed with prostatitis in the absence of anything being wrong with their prostate. There's just like, well, there's like this weird constellation of symptoms, and we're going to call it this. And then they get put on an antibiotic, and then they
Mhm.
feel pretty good when they're on the antibiotic because the antibiotic is usually Cipro, and Cipro has an anti-inflammatory component. And so they feel pretty good when it's like taking Advil,
Yeah.
when they're on it, and then they go off of it and then immediately all of their symptoms come back. And then they're like,
Yeah.
what happened?
Right.
So obviously I'm like a little spicy about this one because what ends up happening is
Please.
that they go back and they're just like in this like endless
Yeah,
loop
yeah.
of like, and then I went to this urologist and then he made me do this test and like all of this stuff. And I'm like, just send them to PT. Please. It
Yeah.
might, they could have anything, any of the symptoms we mentioned, they could have. But definitely the urinary ones are like very common. A lot of those people will come from urology.
Yeah. And, in PT, we get a lot of these umbrella terms for a bunch of different things going on with patients. I'm here to try to like generalize it for people. Like, let's say someone has back pain, and 90% of back pain is non-specific back pain. Like, there's nothing really structurally going wrong. It's just like, hey, he's got back pain. MRI, it looks pretty much clean. I'm not gonna do surgery on it. The umbrella term is just, they just have back pain.
Hmm.
When they should have just came to us in the first place instead of like going through this rabbit hole of MRIs, X-rays, all these other things, and we could
Because
explain to them.
it's also scary, right?
Yeah.
So
Oh
like you're
yeah.
going to this doctor, imaging, the readout, if you ever read the actual words on
Yeah.
imaging, it's like very threatening, very
Mm-hmm.
scary. You know, you're going for all these tests, like in the example of back pain, the imaging stuff, but like even in the example of prostatitis or
Yeah.
chronic prostatitis, you're going for all these tests. You start to get
Yeah.
worried that something is like very medically wrong with you. It's
Yep.
very scary. And it
Mm-hmm.
just plays into the stress of it all. And we haven't even
Yeah.
talked about it, but like your nervous system can wreak absolute havoc
Let's
on
talk
your
about
pelvic
it.
floor. There was actually, so Bloomberg just published this article. I forget exactly what it was called. I feel like I wrote it down. It was called The Stress of Wall Street is Sending Men to Pelvic Floor Therapy. And then the subtitle was Physical Therapists in New York are seeing an uptick in younger male patients with penile and bladder issues.
Whoa.
And it was
Okay.
so funny because when this article came out, like there were I was getting like two very like specific versions of people's reactions to it. Some people were like, "Wow, this is so wild. Who would have known?" And
Yeah.
every pelvic PT that
Yeah.
I know posted it and was like, "Duh."
Yeah.
Like we know. But I think it's good for like these larger news sources to be like, "Hey, like this is a problem.
Yeah.
This is a great example of like, hey, look, there's this like PT thing that can actually help you with this stuff." But
What is
but
this?
that's like, but it's like it's like so true. Like if you are it like stress, and when I say stress, I mean any form of stress. So
Oh
obviously,
yeah.
like Wall Street stress is a very specific form of
Sure.
stress,
Yeah.
but like not sleeping enough, not getting enough nutrients,
Yep.
not having enough water, poor blood sugar regulation, not pooping every day,
Mm-hmm.
like digestive unrest. All of these things are things that are like physiological stressors on the system. And any constellation of those things
Yep.
could affect your nervous system. And so, I live in New York City, so there's this very kind of like go, go, go
Boo.
mentality all the time, right? Like I think a lot of people really fall victim to that.
Yeah.
I always tell people, I'm like, for most people, a mindfulness practice is like a nice to have. If you live in New York City, it's a requirement. Like you have to have
Yeah.
something
Mhm.
that pulls you back into yourself. And so, that's a very real part of managing a lot of these like high tone pelvic floor issues, but it's not just pelvic floor issues,
No.
right? It's back pain,
It's pain.
it's everything.
Yep.
Pain, it plays that nervous system dysregulation plays right into all of our body's pain experience and like
Yep.
increases the threat level of everything we experience as
That
humans.
fight or flight system, people are always ready to fight in this modern age of, like you said, go, 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 working all the time, getting money all the time. Relationship stress, family stress, you name it, can contribute to anything: back pain, pelvic pain, shoulder pain, neck pain.
Yeah.
And,
There's a
thankfully,
certain amount though. I think sometimes people hear like, "Oh, your stress is contributing to this." And then what they hear is like, "Okay, so you're just telling me to calm down."
yeah,
Basically. It's
yeah,
like, "No, no, 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 no. I know that as a 30 or whatever year old man working in consulting in New York City, we can't change those factors.
yeah,
What we can do is like take a step back and be like, okay, here's the like where can we intervene? Like what can we do
right,
to try to decrease that over like what are the behaviors we can maybe add to your
yep,
lifestyle when there's not really anything we can take away,
right,
you know?
right. And we're not saying that that's just all in your head. That's also not what we're saying. We're just saying to be aware of these things, that they contribute to, I mean, any pain really. So, you know, um, and people kind of just, you know, and we're the biomechanics people, we're the anatomy people. So it's hard for them to hear it from us that, like, hey, stress contributes to this. What's going on at your job contributes to this as well. So sometimes it just helps the client to be aware of, like, hey, I mean, this stuff also contributes to pain. Don't just completely ignore it. And we could try to give them some strategies or whatever. We're not the experts on that, but at least sometimes even just kind of throwing it out there and being aware of that, can
I
help a
would
little
argue
bit.
in some ways actually that we are the experts on
Okay.
that.
Yeah.
I
Sure.
think that I mean, hopefully at this point in time, with everything we know about how pain and our nervous systems interact, physical therapists are like taking ownership of that
Right.
and learning more tools to teach people.
Sure. 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 Yeah.
There are
Yeah.
plenty of other, like, mental health therapists, even some dietitians that I work with in my private life and then also in my like clinical network. Like there's a lot of places where you can get that, but I think that we need to take ownership of that because
Yeah, I was speaking more towards, like, let's say in PT school, like, we're all like anatomy, not most, all schools. Thankfully, we're getting a little bit more biopsychosocial, like I said, but like most of the curriculum is still geared towards that stuff. But yeah, I mean, it's within our scope, but we also can't like go over the boundaries with that stuff either. But um, being a holistic provider, we can, definitely touch on those things and give them strategies for it. Um, exercise in general is good for all that stuff regardless. So educating on that helps a lot too. Um, so, but yeah, I mean, as always, pain is multifactorial, so many things going on. It's hard
right.
sometimes to just like sit down with somebody and explain all these things. There's only so much time we have with somebody. Again, thankfully, we could have more time that we're, working for ourselves and all that. So that's always a good thing.
Hmm.
Let's see what else we got here. There's so many things to touch on with pelvic health. Um, Besides assessing tension, I put down like pressure systems, coordination with your breath. Can you expand
Hmm.
on those things a little bit?
Yeah. So the explanation of the evaluation that I gave is like just the pelvic floor piece of it. But, the evaluation also includes looking at the whole musculoskeletal system. So, there's two things that are like, there's a lot of different things we can look at, but on the sort of base level, we have to look at how does the body absorb and produce force. So, is there in the places where the body needs to absorb force? can it do that? So at the foot, for example, the foot has to be able to pronate. It has to be able to flatten enough through the gait cycle. At the hip has to be able to internally rotate enough. That's a force absorption pattern at the hip. The trunk has to be able to stiffen. Like, can you successfully use your abdominal wall? What is your diaphragm doing? Can it move? Or are you stuck in this kind of like inhaled position or exhaled position? Are you able to breathe into the entirety of your rib cage?
Yeah.
Um, and there are other pieces of that, but those are sort of like key hallmarks of that. And the reason that I care about those things. I care about other ranges of motion too, but those things, the pelvis is a load transfer zone in the body. When your foot hits the ground, forces are traveling from your foot through the leg via the pelvis to the upper body. And most of the things that we do are rotational. So we have to be able to transmit those forces up and down. And if we're not absorbing force well somewhere, sometimes the pelvic floor is the thing that's like taking over.
Yeah.
And that's like on a sort for a person who is maybe a runner, or somebody where they're doing like some kind of reciprocal thing like that, that is like really important. From a pressure standpoint, the pelvic floor is the bottom of a pressure system. So you have your pelvic floor on the bottom, you have your abdominal wall around the trunk, you have the diaphragm on top of that. And then even on top of that, you have the glottis, which is what like closes off your throat when
Hmm.
you're trying to hold your breath or when you're after you've swallowed, that kind of thing.
Yep.
And so pressure is going to go somewhere in that system. And we want it to be able to be distributed as evenly as possible. And so there needs to be successful expansion and compression of that system, both in the rib cage and in the abdominal cavity. And so we're looking at that in various different ways. And also we're looking at it in the context of like different breathing conditions, like what happens when you inhale, what happens when you exhale, what happens when you hold your breath. How are you doing those things under the demands of whatever your exercise is, like heavy lifting
Yep.
or whatever. I've worked with singers who have issues with their pelvic floors because they are using this very kind of like bottoms up tension strategy and are struggling to engage with other parts of the canister to produce enough exhale force basically to hit a high note. So they're like doing it by creating this tension down below. And so, there's a lot of reasons why we care about that stuff. But from like a zoomed out standpoint of what we're looking at in the pelvic floor assessment, that's those two things are a big part of it.
Okay. Gotcha. Let's try to go back again more, like you said, just zoomed out. We just mentioned that, but like in conjunction with like low back pain, hip, SI joint pain, like how do you start piecing everything together when it comes to evaluating somebody with back pain? Like, where do you start with that? Do you also assess the pelvic floor? Do you always assess the pelvic floor with these types of pains? Um, how do you start with that?
Um, I feel like it depends always.
Our
Like
favorite answer, yeah.
if a person is just like newly coming to me with back pain, and was referred to me for back pain, or like that's their chief complaint, I'm a pelvic floor therapist, so I'm always thinking about it a little bit.
Hmm.
But I will probably manage it. I might ask them if they're having any symptoms. Everybody who comes into my office gets the same intake form.
What do you ask them
So
then?
they
Like, what's
have
a
a
general way of screening for that?
I'm asking them I'm asking them a lot of the things I've already mentioned that are symptoms. Do you feel like you have to go to the bathroom all the time? Do you feel like you have to push out your pee? Do you have a bowel movement every day? Have you ever in the last year experienced issues maintaining or achieving erection? Do you have pain with arousal? Like those kinds of things.
Yeah, it's
Um,
important stuff.
but my
Yeah.
intake paperwork has all of that stuff in it,
Hmm.
and everyone gets the same thing. I don't care if you're coming in for knee pain or penile pain, you're getting the same form because I'm giving everybody the opportunity to be like, oh,
Yeah.
maybe I should tell somebody about that.
Yeah. Right.
You could help me with that. Tell me more. So I usually will read the eval form, and if they haven't ticked off any of those symptoms, I usually assume that they aren't there unless I am like on the first day, and then I'll kind of come back to it later. But there's so much, like I was just saying, right, with like the foot and the hip and the pelvic girdle and like all of
Yeah.
this external stuff. There is so much that you can do without ever doing like a hands-on like palpation pelvic floor assessment, that
Mhm.
a lot of times it's always in the back of my mind. Maybe I'm giving them exercises where I'm targeting it, and I'm just kind of like seeing, like, even if I think it's there, can I resolve it without ever actually doing the internal part? Not that I'm not, I will tell them that that is what I'm doing,
Yeah.
but because I want them to be aware and then maybe tell their friends that this is a thing that people can get help with.
Yeah.
But I don't really have to do the internal part of the exam a lot of the time. I feel like it,
Yeah.
honestly, I think it has been overused sometimes
Okay.
in pelvic PT. And I think sometimes we forget that we're also like orthopedic therapists who can manage a lot of this stuff in a more holistic
Yeah. Oh, yeah.
way.
And yeah, and I'm gonna zoom out again, and I think a lot of in general PT people overuse hands-on stuff, or that's people, again, people think we just do massage or something, and I'm like, no, not at all. I mean,
I
it's
literally had a patient come in. It was her first. It was their first session today, and they were like, you can do whatever you want, but please don't poke my psoas muscle. I've had so many
yeah,
physical therapists do that, and it just like doesn't help me. And I was like, I was literally not even going to put you on the
right,
table.
yeah,
Like, it's just crazy. And it's like this person now feels like scared to go to physical therapy because they're
yeah.
afraid that they're going to get poked. I'm just like, come on, guys, do better.
Poking already painful and tight muscles, possibly sensitizing it even more, and just creating this vicious cycle of more sensitization of that muscle, especially when I do it super hard. I'm not saying that always happens, but
Yeah.
the possibilities there.
Yeah.
Um,
I mean, with the pelvic floor stuff, like again, I'm not saying that there is never a
right.
reason to do internal exams, to do internal treatment. I do those things every day.
Hmm.
But I do think that there sometimes are times where, like, if you just think one step further, you can maybe give somebody something that they will actually do at home
Yeah.
so
Yep.
that then, you're like accelerating their progress. A lot of people, honestly, especially men, are not going to do internal self releases at home. They're going to come in, they'll be totally game to do it in the office. They don't want to do that at home. So
Hot take.
it's they don't. At least the
We're
guys
gonna
who
clip
have been
this.
here to see me.
Yeah.
So
Yeah. I mean, it makes sense though. But yeah, going along with that again, like, I think was this last week? I had one guy with like hip flexor tendonitis, and like you said, the PT before at name whatever outpatient mill PT place, all they would do is just try to release it, poke on it, try to release it. I'm like, what stuff did they have you doing at home? Like one general hip flexor stretch. I was like, oh god, did they try to strengthen it at all? And they were like, yeah, isn't this a strengthening exercise? It was a stretch, of course. I was like, no, it's not. And so I gave him a lot of homework to strengthen it to get better, and he's good now. And he was like, oh, that's PT. I was like, yeah, yeah, it is.
yeah,
And I'm glad I got you stronger and more resilient and self efficient, at
yeah,
home, because a good PT, they're not going to need us all the time. If we give them the right tools to do at home without us working on them all the time, that's the best case scenario,
yeah.
I
I
think.
mean, I think too, like, the more this again, I'm going to give like a pelvic example
Sure. Yeah.
because that's what I'm here to talk about. But like, the more that we are out here talking about that, the more I think the message comes across. I will say, like, usually I'm not a fan of people Googling their symptoms because I'm like, the internet is
Yeah.
gonna like tell you you have anal cancer or something.
Or
Just like,
AI. Yeah.
don't do that. But I will say that like a lot of men find out about pelvic PT on Reddit, and they are actually going and getting help. And not only that, they're finding pelvic PTs on Reddit, and then they're going to a pelvic PT, and the pelvic PT is just like doing a bunch of internal stuff. And they're like, you know what? I read on Reddit that there is a
Mm-hmm.
connection between my hips and my pelvic floor. So I'm going to go. Like, these are the people who are then coming to me being
Right.
like, tried that person. They didn't give
Yep.
me any hip stuff. And now I'm here. And I'm like, honestly, great. Like,
Fine.
I love
Yeah.
that you took that level of initiative to do this for yourself. But like, we shouldn't need people to do
I
that,
know.
you
I
know?
know. It's
But
tough.
anyway, my point is just that like I think that like all we can do really is just like do this and tell people that there's another way, and like also thank the people on Reddit for for spreading the
Yeah.
good word.
Do you scour Reddit to like,
I do actually.
nice.
And now that I learned that, I'm like, let me just see what people are
I
talking
thought
about.
about it. Yeah. There's a whole like community there of PT and stuff that
Oh, I joined like multiple like men's health
okay.
channels just to be like, what are people even asking? I want to know,
Have you
you know.
commented and talked to
I'm
them
a
or
lurker, to be honest. I'm definitely lurking. But it helps me like understand what kinds of questions people have. What's even more fascinating, it's fascinating sometimes, is like the answers that people give. But if I
yeah.
see something egregious, I will comment.
I think
But
I've
I'm mostly
commented
just
on some stuff. Yeah.
Yeah, I mostly just like lurk in the shadows and be like,
Yeah.
"Oh, that's what people are talking about.
Well,
Interesting,
well, I
interesting."
lurk the what is it? I think it's just called the physical therapy subreddit or something. I'm not familiar with any of this stuff, but like a lot of these, and we could get into this different podcast, but like different gripes with healthcare and the profession itself. And I've commented, uh, subreddit. No one said anything one time. I was like, all right, well, I'm lurking too now, but maybe I should be
Yeah,
more, engaging with it. But
I don't know.
if you
You
guys
really
see
want to spend
this,
your time doing that?
what's up? Um, you guys could, my stuff is on the YouTube channel if you want to,
Right.
message me. I'm
Like and
here.
subscribe.
I'm trying to help you guys here. You know what I mean? We're all in it together
Yeah,
to help educate about PT. So,
yeah,
um,
yeah,
let's get into more like actionable items. I know, again, everybody's different and it's hard to, without a thorough assessment, it's hard to give basic pelvic PT advice. But like, what are good habits for men specifically that can maybe help them avoid these symptoms with, erectile dysfunction, premature ejaculation, the big ones, let's say.
yeah.
Um,
Um, I think that this is like for desk workers, right? And I think this kind of goes for a lot of different things. But a lot of people just are in the same position all
yeah.
day, every day.
Me right now sitting
Um,
here, I'm like, ugh, gotta
Right?
move
I'm like
around.
not used to sitting for that long.
Yeah, me neither.
But the more variability you can introduce into your day
Yep.
in positions, postures, like we don't rotate that much as humans, and a lot of like it's like our nervous systems really like that. It's like a massage for your guts and for your nerves. So like anything that you can do that's like a more twisty motion, even if you just like take a break and like lay on your back and windshield wipe your knees from
Yeah.
side to side, something to move across midline.
Yep.
um I think a lot of times like standard strength training programs have a lot of like 2 feet or 2 arm lifts, like the basic convention, basic like compound lifts.
Yep.
And so if you are a person who's lifting, introduce some variability there. Do things
Yeah.
on one leg, do
Yep.
things that are rotational. One leg exercises are pretty much pelvic floor exercises because your pelvic floor muscles are working with your hip musculature to stabilize you on one foot. So
Yep.
introduce some new patterns to your training program.
Okay.
Um, Nervous system regulation. It's so hard, but, like, there needs to be, at the very least, if you're working, like, a very stressful job or something like that, there needs to be a wind down period. Like, you need to have a time where it's like you don't just, like, get home and make dinner and go to bed. Like, you need to have a time that's maybe not watching TV, because that's not always, like, a wind down, but, like,
Yeah.
something that it doesn't have to be, like, meditation. It could be, like, a short walk with,
Yep.
like paying attention to your surroundings,
Yeah.
like
Yeah.
something that kind of like puts you in your body and in your
Yep.
environment to help
Hmm.
quiet your nervous system. Um, Use a squatty potty for your bowel movements. Get your feet up on something higher than your knees. It will help things come through for reasons that we didn't really get into. But basically it like makes a straighter line from like the end of your colon to the end, like
Yep.
to the anal sphincter, easier pathway.
Yep.
Um, Drink enough water, eat enough food, you
Yeah.
know,
Stress
the
less.
basics.
I think you got me on the squatty potty like 2, 3 years ago. I still have it and I use it, and
That
it's
thing, I tell people this all the time, like, so I live with my husband and I bought a squatty potty for our bathroom and he was like, "What is that?" And I was like, "Use that thing one time. It will change your life."
yeah, they're
And he
great.
was like, next day he was like, "You were right."
Yep.
And I was
Just
like,
comes right out. Love it.
"I know. I know I was right."
Slides right out. Um, all right. Where can people find you? Social media stuff, website.
Yeah.
Go ahead and tell us all that.
Um, I I am in Brooklyn, so if you are in New York City, I'm located in Dumbo. But you can find me on social media. My clinic's Instagram is at EmpowerPTNYC, and my personal Instagram is at Dr. Julia Rosenthal. Our website is www.empowerpt.nyc, and those are probably the best two places to find us.
Cool. Awesome. Yeah, and you guys can find me as always on Instagram at APT Dr. G. Website artofpt.com. I have my newsletter, the PT Handbook, which you could subscribe through my Instagram website. It's everywhere. It should be on the YouTube description as well. I do have an ebook coming out about back pain, which will be out maybe in a couple weeks, and I'm gonna try to record myself doing the audiobook as well. So be on the lookout for that. And thanks, Julia. I appreciate it.
Yeah, thank you. Thanks for
Yeah,
having me.
yeah. We'll see you guys next time. Peace.